So I think PTs need to have, a strong understanding of differential diagnosis. And then I think it really helps. We've noticed this, going through the program, it helps understanding your local environment really well. I think you have to be confident with differential diagnosis.
Welcome back to Orthostatic, a product of the Academy of Orthopedic Physical Therapy, where we explore innovative ideas that are reshaping the landscape of orthopedic physical therapy. Today, we have a special guest, Dr. Seth Peterson, owner of the Motive PT in Tucson, Arizona, and recipient of the prestigious Innovative Practice Award. Seth has pioneered a digital physical therapist triage program that aims to reduce unnecessary emergency department visits by providing telehealth triage for urgent musculoskeletal conditions. We're excited to dive into this cutting-edge approach to care and discuss its potential to impact our profession on a larger scale. Here's that conversation with Seth. So Seth, welcome back to Orthostatic. Appreciate the time.
Yeah, thanks for having me, Jimmy.
Well, first and foremost, congratulations on the Innovators Award. That's got to feel pretty nice, right? Being recognized by colleagues.
Yeah, it's awesome. I mean, great thing that the Orthopedic Academy is doing. What is it, 50-year anniversary? That's huge.
Kind of a big deal. And Innovators is like in our mantra now, like making sure the largest component of APTA, can we lead? And I guess step one is to lead by example. And when your members are really your strength, that's really your thing, the thing that binds. Doing something like an innovation award is pretty powerful. Let's talk about why you won that award, right? Tell us a bit about telehealth triage. How does it work in practice? What kind of cases were you seeing? And then this is sort of the origin story. Why did this come about? There had to be a problem that you sought to overcome.
Yeah. So like most people, I think that got into telehealth. It was, I actually had a background in telehealth going into COVID. So COVID, prompted a lot of people to dive into telehealth, obviously. Right. University of Arizona has the largest state-funded telemedicine program in the country. And I discovered this and kind of had a little mentorship with the director of the program, who Ronald Weinstein passed away a couple years ago, but huge deal. I mean, he had like a whole New York Times spread and everything when he passed away, and just a huge change maker in the telehealth space. So I got to spend a little time there and then have that kind of prepped. So then when COVID hit, it was like, on a Friday that the governor signed the declaration. And then, on Monday we were using it. And pretty quickly we noticed that there are people, because of, the circumstances around COVID, they didn't know, hey, should I go to the emergency department or not? They were afraid of being sick at that time. So it kind of clicked into my head pretty soon after that, hey, there's an opportunity here to kind of go further upstream than I think what people are maybe even thinking. So can we stop people from going to the emergency department without even being in the emergency department? Maybe stop those ahead of time. So we started kind of soft launch. This is all we've done so far. But I actually talked to Rebecca Griffith, Mark Milligan, and we presented at CSM, after this on this concept. And really it's something that, I'm glad the Orthopedic Academy recognized it, but hopefully it's a concept that gets adopted in a more widespread way. I mean, we're a really, kind of small clinic. There's 2 PTs. We're going to grow to 4, but that's about it. If I could get this as a concept that spreads across the US, I think it could be huge in terms of cost savings and getting us as far upstream, I think, as you can possibly get.
Yeah. Well, can you tell me a story? Tell me a story, maybe an example of where this triage system helped a patient or patients avoid that unnecessary ED visits. It had to lead to better patient outcomes, I'm guessing.
Yeah. I mean, I think maybe the best one that's probably the most applicable for musculoskeletal PTs to think about is there was a patient that called and had radiating leg pain that was severe and back pain, and she wasn't sure if she should go to the emergency department for that. So we were able to find a 15-minute time slot and just have her jump on the computer and go through a movement screen. So in that 15 minutes, I could tell right away she did not need to go to the emergency department. She was going to be okay, and then start her with just a couple little simple movements and concepts that she she could do to kind of mitigate the symptoms a little bit until she could get into the clinic. So that was an easy one. There was another kind of older patient that called who was in her like late 80s, I think. And at night, she had, went to the bathroom, sitting down on the toilet, had sharp knee pain, and then couldn't walk and wasn't sure if she'd fractured her knee. She had osteoporosis. And so then just going through this, quick meeting, that was, she called first thing, 7 a.m. in the morning. And we were able to find another time slot, 15 minutes, and take a look at her and run her through the Ottawa knee rules and say, hey, look, I think this is fine. I think it was probably, she did not fit that. But, you know, kind of set up a little follow-up visit with her the next day. Her symptoms were already a little bit better. And then she came into the clinic the day after that. So again, that's two patients we stopped from going to the emergency department.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With gait analysis, continuing education, and technology, RunDNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
So what kind of training, if someone's nodding along, if someone's saying, okay, this feels innovative, but what do I need to actually do this? What kind of training do physical therapists need to safely and confidently perform digital triage? Is this something that can be easily replicated in other practices?
Man, I mean, I would love to say that the entry-level PT could do this. And I think to some degree they could do it, but I think you have to be confident with differential diagnosis and knowing, like I just alluded to the Ottawa knee rules, you have to know those, or at least be able to know that they exist and be able to bring them up real quick. So I think PTs need to have, a strong understanding of differential diagnosis. And then I think it really helps. We've noticed this, going through the program, it helps understanding your local environment really well. And so that was something we talked about. John Hike and I wrote a paper on referral decision-making in physical therapy. And a big concept within that is to understand, what's the most easily accessible hospital in that area. Maybe there's a company that, how is someone going to be able to get transportation to the hospital if they need that? And then maybe have some relationships with local physicians that you can get some urgent visits in. So get some clients in and patients in to go see them real quickly if you need to. So all those, I think, lend this a little bit more to someone with a little bit more confidence and experience, and maybe a little bit more background in differential diagnosis.
Yeah.
In theory, if you had a strong mentorship program, you could get somebody going with this in, 6 months to a year, I think.
So far, we talked about the good, the shiny, but there needed to be some problems, right? And I actually like talking about the problems or the failures because I like to see how people got around them. So, what challenges did you face in launching it, right? What were the things that were difficult so people can kind of get a picture of that? And then how'd you get around those things?
Oh yeah, I mean there are a lot of challenges with this. I mean, one thing we've had, just to quickly nod to it, is we've had some difficulty getting the word out about this, and then getting patients to feel like this was, why would I do this? Why, going to the emergency department is not that bad. I mean, I think you almost have to experience going to the emergency department to really understand why that's good to avoid that.
Right.
But I think that's maybe one hurdle. It's not as big of a hurdle. Probably the biggest one that we ran into, honestly, was finding time for the patients in our schedule. We're a small clinic. So if someone calls, to be able to efficiently do the exam in 15 minutes, but then also, I think that's not even as tough as just finding that 15 minutes on the schedule lately has been tough.
Yeah. Sounds like logistics, communications and logistics,
yeah,
which touch practices, right? We have these problems. And as I was taught, and I resisted this advice when I was first given it, people don't run anything. People don't run companies. People don't run practices. And I was like, what do you mean? Of course they do. And they said, smart people run processes. Processes run organizations. And as soon as you sort of understand that mindset, it's not saying that people aren't important. People are terribly important, but to maximize that person, right? And so when you have that process, it's repeatable. Doing it once is nice. It's neat. but you don't win an innovation award for doing it once. It's how do we do this and how do we scale this? So how might you envision? This is where you don't get to say what you've done, but what you might or what someone else might done. How pie in the sky, how would you envision this if processes were solved and put in place to scale something like this?
Man, I mean, I would love it if things were just in general in healthcare
I know,
could
right?
talk with each other. I mean, that would be great if somebody could
Wild, right?
call and schedule, on one program and it would communicate with this program. There's almost, at least the way that I've encountered it, there needs to be some middle person at the current time. But that would be great if someone could just log in, could find a slot on the schedule, or could request something that would at least ping us to, get this person in. But that's us. I mean, and we're going to develop a little mentorship program around this, and I think that little grant from the Orthopedic Academy is helpful for that. But I think it would be great, like I said, for this concept to be more widespread.
Sure.
I mean, full fledged, we hire a couple more PTs, we're still going to be small in the
Sure.
big scheme of things. So locally, can we get 4 or 5 more clinics doing this? Across the country, can we get more clinics implementing things like this? And then part of that, I think, making this as effective as it can be is people continuing to push kind of from the legislative and leadership fronts to try and get physical therapists more easily, able to order imaging and things like that, so that we could just send the patient straight to an imaging department instead of the emergency department.
Save the date for the 2024 AAOMPT conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit AAOMPT.org for more information.
What advice would you give to other clinics or therapists interested in incorporating telehealth or digital triage like you did into their practice? This is where you get kind of pull them in real close and say, okay, here's my bit of advice or things you should pay attention to.
Yeah, I mean, I think a big thing is it's probably not as daunting as what you think. There's tons of resources out there now, but the APTA has a website on telehealth and telerehabilitation, and just getting a background and understanding maybe what is different about that. That it seems like, hey, I'm a physical therapist, and I have snowbirds in Arizona that go up to Michigan. And if they have a problem, they should be able to they can just hop on their computer and I can see them, right?
Right.
But you cannot.
Right.
Right. When someone's in Michigan, that, you're not licensed unless you're licensed in Michigan,
right.
And the PT Compact, that opens up some opportunities, but it's different, right? So there are different rules that apply to telehealth that people need to be aware of. But as soon as they're not that complicated. If you can understand that, if you can understand, how HIPAA compliance applies to some of this stuff, then you can really be off to the races. And I think there's a lot of opportunity there. Yeah, I mean, there's just so much. There's research. There's a clinical practice guideline that's coming out and maybe has already been published, I think, from PTJ on telehealth. So yeah, there's a lot of information out there. I think maybe you just start with the simplest stuff, understanding, the basics about it, and then growing your knowledge from there. But it's something that everyone should be able to do.
Sure. Well, Seth, want to say congratulations, but really wanted to give you your victory lap in sharing what you were awarded for in terms of the Innovative Practice Award from APTA Orthopedics. Last thing we do on the Orthostatic, the tradition is words of wisdom. What would you want to leave as we wrap up the episode with the audience? Any words of wisdom or a mic drop moment about your innovative practice model?
I mean, just a broad concept would be, I hope there are people that are listening to this that continue to try to push us to the top of scope in terms of our practice. Try to get out there and help people maybe before they can get to, emergency departments, surgery, things like that. I think that's where we make a huge impact in the system.
Yeah. To quote somebody you brought up earlier in this episode, Rebecca Griffith, she has this great quote. She says, use your familiar skills in unfamiliar places. Those things that are simple to you in places that they aren't, suddenly you seem innovative, and you are. That's actually what innovation is. Seth Peterson, congratulations again on the award.
Yep. Appreciate it, Jimmy. Thanks.